Hi, it's Dr. Matt Russell from Vizon. Today, we're going to answer the question, can I get cataracts after having lens replacement surgery? Well, the interesting thing is that both cataract surgery and refractive lens replacement are very identical surgeries. Now, refractive lens replacement, we're using advanced lens technology, implant technology, more advanced than what we'd use for standard cataract surgery. And we're using that to correct the optics of the eye. So we're correcting any initial prescription you may have had. So if you were long-sighted, short-sighted, or had astigmatism, we'd be using that implant to correct those focusing problems. But most importantly, we're also correcting what we call presbyopia, which is a loss of the ability to change focus from far to near without the need of glasses. Now, that process of presbyopia usually starts to affect everybody, usually in their mid-40s and beyond. An advanced lens technology can eliminate the need for glasses for both distance vision and near vision, or if not eliminate it, then rarely ever need to use them or only in very special situations. That's very different to cataract surgery, and where we use a standard lens, which may or may not free you from glasses. The aim of the lens in that situation is really just to restore the clarity that's lost from cataract. But because when you go through lens replacement surgery, we've already removed the natural lens, you're not going to go on to get cloudiness of the natural lens because it's gone. And so therefore, you won't get a cataract later in life. Now, because you've got an artificial implant in your eye after lens replacement surgery, that implant doesn't change with age. So your vision, once it's restored after lens replacement surgery and you've got great distance vision, mid-range and close vision, and you're not needing glasses at all, or you're only relying on them for very, very fine print or in very dim light, then your vision remains stable. It doesn't tend to change. It doesn't change because you don't have a natural lens, and it's usually the natural lens changing inside the eye after the age of 40 that causes our prescription to change in most cases. Now, there's such a thing as a secondary cataract. Now, what about secondary cataracts? Am I going to get a secondary cataract and need to have another operation? Is something that we commonly get asked. And the answer is no. Secondary cataract, or what we now call as posterior capsular opacification, is a haziness in the capsule or the structure that holds your natural lens in place. And we borrow that structure and use that structure to hold the artificial implant in place. On the surface of that structure, some cells can proliferate and can lay down a thin layer of scar tissue, which can affect the vision quality. The vision can become a little bit hazy, it can become indistinct, and it can also cause glare issues, particularly at night. And this usually comes on somewhere between 6 months and 2 or 3 years after lens replacement surgery. It tends to affect the quality of vision fairly early if you've got a multifocal implant inside the eye. And so it's not uncommon around 3 to 6 months that we'll do something called a YAG laser capsulotomy treatment. That's a simple treatment that's done in the clinic. It's painless and it's a once in a lifetime treatment. What that does is it opens a window in the capsule which restores the clarity of the vision. And once that window has been created, it never reforms. So at some point after going through lens replacement surgery, you are going to need what we call a YAG laser capsulotomy, which is a painless procedure that will get rid of any secondary cataract formation, and it will keep the implant clear for the rest of your life. So if you're over the age of 45 and you've noticed your vision is deteriorating and you're becoming more reliant on glasses, particularly for reading and computer work, and you're wondering what you can do to free yourself from those glasses, it's likely you're a good candidate for lens replacement. So go online and book a free assessment today and see if that's a good option for you and to see if you're a good candidate for the procedure.